I'm Jim Check. You're watching Kelowna Now. I have with me Martin Johansen, Mayor of Oliver since 2018.
Yes.
And the reason we're talking today is you're kind of like winning this race in British Columbia. 40 closures in your Oliver ER department since January.
Yeah. I think this is probably the most we've had. We had a period last year in the summer where we had a much more extensive run of long-term closures. And at that time, we were working on something with the Ministry of Health, an alternative payment plan for the physicians working here, kind of a contract wage for them, so that when they came into the ER, there was a guaranteed salary for that shift. And that was a big thing to get over the finish line, and we got that early in the year, and we were hoping to see some better results from it. And the result is that we really haven't seen the changes that we were looking for. We also received some recruitment retention incentives later in the year, in I think May or June. So these little things are helping, but we're still struggling to keep the ER open.
Oh yeah, so it's is it always related to the doctors, or is it nurses too, or?
I think we've been very close to having closures related to our nurses. We're supported by a large contingency of travel nurses here keeping our ER open, but all the closures that I'm aware of have been related to not having a physician.
Yeah, so I'm obviously you've been, like you said, you've been working with Interior Health, you've been working with the minister, and you put a couple of different plans in place. What's been the mood from the residents on all these closures, though? You must be getting some heat from that as well.
Well, there's generally frustration in the community. You see that online mainly. I haven't had too many people reach out to me. I've had conversations, sort of ad hoc conversations with people on the street or when I meet them at a public event or something like that. Online, I think there was a frustration that was being vented against the NDP government that they're not solving the problem. And I do hear from the new government, that was some of the new ministers that were sworn in yesterday, that this is, the ER closures in rural communities are going to be a real focus. So I'll be interested to see what comes out of that. I learned yesterday that Josie Osborne is the new Minister of Health. I've had some connection with her when she was the Minister of Energy and Mines. I have reached out to her today, trying to connect and continue some conversations about some of the things that we were working on before the election. And one of the big things that we were working on with the Ministry of Health and Interior Health was getting access to some unused IH lands. And we have access to that now, and we're looking to build some dedicated housing there. We started up a local physician recruitment working group here in the town of Oliver. We have a number of physicians on that working group. And the number one barrier to attracting healthcare workers and or physicians to our community was identified as housing, and dedicated housing, so that there's always housing available. It's something you can stay in for a night, 2 nights a week or two, be here for locums, traveling nurses, medical students, all those types of things. So that's something I'm working on right now, and I need to connect with the new Minister of Health about that to make sure that we keep this project moving forward.
Yeah, you'd think that would be one of the easier solutions, is to have some type of housing so that they could bring in Vancouver or Lower Mainland doctors and that to kind of supplement whenever there's a shortage, so that the city of Oliver or different communities throughout the province of BC. It's not just you guys, right? It's Merritt, it's
Right.
Valley,
Yeah.
it's rural communities that are suffering, right? And a lot of times it's because they don't have a way to kind of like house them properly, and a lot of them don't want to stay in on like an older motel or something like that.
Yeah, there's not always access to a hotel in busy tourism season, or people have run bed and breakfast or VRBOs only during the winter time. There's no dedicated place for people to stay. And by having this housing, the other piece of the puzzle, like you mentioned, the Lower Mainland, I think we'll be able to attract healthcare workers, physicians from further away, because there will be a place for them to come here and stay for 1 or 2 weeks, and it's an opportunity for residents to come here and work because there's housing for them, or students, because we feel like that's a big piece of the puzzle as well, is getting people that are just getting educated and healthier to come and support our local physicians.
Yeah, I mean, we've been trying to highlight this issue. We do stories all the time, including keeping the count. We've reached out to the minister, Adrian Dix, the former Minister of Health, many
Yeah.
times asked for an interview and not received interviews. So hopefully, with this change in the ministry, that there is some better response and like a real focus on finding a solution for this, because it does seem like sometimes that, like outside the Lower Mainland, British Columbians don't seem to get the same level of care, especially when it comes to like basics. Like there's some places up in the Prince George area where people were being asked to drive 400 kilometers to the nearest ER department.
Yeah, 100 Mile was having lots of closures. You're still seeing them lots in Merritt and Lillooet and different communities around Ashcroft, smaller communities. Like when the ER closes, you right away you don't have timely access to a healthcare issue, especially an emergency healthcare issue. And our ER is also important for residents that are unattached. Like in a rural community here, we still have a few thousand people that don't have a doctor, so their only access to the healthcare system
Yeah.
is the ER, and it also puts a lot more weight and workload on first responders. Our first responders basically become the mobile ER department, and they have to manage and take care of patients until they're able to get to Penticton. So there's more travel time going on there, and then of course there's the ripple effect where the PRH Penticton Regional Hospital is emergency is overloaded and wait times are longer there. So it's not a good solution. If you want to deliver healthcare, you need to keep our hospital open. It serves not only people in Oliver, but think of the radius down to Asuyas, over to Costin, and even Karamias come here. There's a lot of people that come here, and in the summertime we've got 40,000 residents down here.
Yeah, the city just burdens in the summer, right? I mean, it's like
Yes,
so
especially Asuyas.
yeah.
Asuyas is probably the one that grows the most, for sure.
I grew up in the Midway Greenwood area, and Osoyoos was our playground. So I understand
Yeah.
this is a beautiful city, and so is Oliver. The valley through there is so beautiful in the summertime.
Yeah.
So
Mm-hmm.
yeah. I guess hope is kind of like what you're kind of hoping for, right? And in a better tomorrow in that regard. Anything that your community is kind of like doing to kind of help, like put pressure on or anything like that, or are you just hoping with a new cabinet, new government that you get some better results?
Well, I'm definitely hoping with a new cabinet that we get more of a focus on rural healthcare. The word from the premier is that is going to be a focus. They've identified a new person as the Minister of Health. Josie Osborne is going to have a huge amount of work getting up to speed. I will be very impressed if I get a call in the next week or two from her directly, so that I can start to have those conversations. I will at the same time be very disappointed if I don't hear from somebody. I mean, 40 closures is that minister should be reaching out to all the rural communities that are having challenges. If that's going to be your focus, then let's start having those conversations and working together. I did feel I had a good relationship with Minister Dix and had a lot of contact and conversations with him, and I hope that continues as well. But I also hear that other communities had trouble having those connections. So hopefully moving forward, we see that they walk the talk. Like if you're going to do something, let's work together and get on it. Our local physician working group, I think, is really taken off, and we've got, like I said, physicians. We've got some community people there. The other piece of the puzzle we're talking about is the marketing program and a red carpet package for people when they come here. And we had an event when we were at UBCM. So later in September, we had a whole group of residents come here and tour Oliver and also tour the hospital and connect with physicians working here. Because it's not just, there's a lot of opportunity here for healthcare workers and physicians as well. It's not just a beautiful climate and a place you can golf and mountain bike and do all the things you want to do. There's actually access to being able to get into some really good working conditions and experience in an emergency department and in a rural hospital. So, and the feedback from the residents, they were very excited to be here and really impressed about how we rolled out the carpet for them and provided them with a day with lots of information and connection with people. So the community's embracing it. Everybody's trying to work together. I don't think there's a magic bullet. I know there's no magic bullet. What we do today is going to take, the fruits of those are going to take years to to come out. But the sooner we get started, the sooner we're going to start having some results.
And you guys have a little bit of an advantage over northern communities, obviously, because of your climate and your location. You're right on the border and all those kind of things.
Yeah.
Whereas, if you're in Lillooet and you're in, Nicola Valley, those kind of things, you don't have the same advantage, especially if you're up past the 100-mile house, 150-mile house, all those kind of places like that. Tougher slugging. So there has to be some incentives to get doctors, young doctors especially, or maybe, doctors near their retirement to kind of like take on those kind of things for a longer term, right? So that the communities can get some stability in their healthcare too.
Yeah, I mean, for sure, you touch on the reality of it. We don't have to do a lot of marketing to be able to attract people to what life is like down here and the things that you're exposed to. So that being said, we've got to look at other ways, and housing is one of those ways, which makes it easier for somebody to come here. Talking about and exposing new graduates and stuff to the opportunities that are here in the healthcare system and the hospital. Lots of people have different interests and different things they want to work on and get experience in. So there's lots of opportunities here from a work point of view, and it's a great place to live.
Yeah,
as well.
Some of the best fruit in the world.
And wine. It's a good
wine.
spot.
There you go. Right?
There isn't anything you can do here that you couldn't do here. You've got access to everything, and everything is pretty close, not that far away.
And
Very centralized.
Outstanding golf course up on the hill there in Oliver as well.
Yeah, Fairview Mountain, but that's one of many golf courses down here. So, yeah.
Anything else you want to leave us with today, or we'll check back as things progress with this new cabinet and see if you can get some results. We're keeping track. We're definitely highlighting that every day till it becomes so embarrassing for them that they have to do something about it.
Yeah, no, I'm optimistic. I'm hearing the talking points that are being used by the NDP, but like I said, I want to see them walk the talk, and I hope my phone rings here in the short term with the new Minister of Health. Number one, wanting to connect, and number two, what can we do together? I've got some things we were working on, so I'm really anxious to continue those conversations to make sure we can move this dedicated housing project forward, because I believe I think that can be a real game changer, and it's anything you can do to make it easier for somebody to travel long distance to come and work here and support our hospital, I think is hugely important. And I look forward to being able to report back that, yes, we've had those conversations and things are moving forward.
Well, we thank you for taking the time today, Martin.
Okay.
And we hope for a healthier tomorrow for the community of Oliver and the area that it kind of supports as well.
Yeah, and thanks for what you're doing, because I tell you, getting word out like this, people pay attention, people listen, and I know I've gotten calls in the past after doing interviews, and so I think that the work you do is extremely valuable as well, getting the message out. So thank you.
Thank you as well, and thank you for watching Kelowna Now.
Okay, take care. Bye-bye.
We don't just report the news. We live here too. We're your neighbors, bringing you stories that matter to all of us. No government funding, no outside influence. Kelowna Now, local, independent. News you can trust.